Hello all, I am Dr. Preeti Alanan, dental surgeon and implantologist and oral pathologist at Kaveri Hospital, Chennai. Today, focus of my video is going to be on what are the common oral challenges that women face during perimenopausal and menopause phase of their life. Menopause is an important milestone for a lady or a life. And we are generally aware of any changes like hot flushes, night sweats, weight gain. So today I am going to basically focus on oral challenges like dentally vaayila vandu enna changes in women going through this particular physiological change. One important thing that I would like to emphasize is that annual medical checkups have become very common. All of us have been taking it quite seriously, both men as well as women. And the annual medical checkup, please do make it a point to go and meet up with the dentist also, because prevention adds a lot of emphasis, Prevention is obviously better than cure, and once we know that there is a possibility of a problem occurring, if you are able to stem it at that particular stage, nothing like it. One common problem, most important problem, which I think women of this particular age face is dry mouth. Why? Onandu polam salivary secretion alla koranchirudhu, adanala there are a lot of effects that is there because of reduced saliva. So enna pannalam adu overcome pannadhukku, especially ipo mask wearnala adu overcome pannadhukku enna pannalana, take frequent sips of water. Wherever you go, carry a small bottle of water, good drinking water with you. Second thing, there are a lot of these sugar-free gums and candies which are available. And they come in a variety of flavors like mint or citrus. So this, if you're just going to suck it in your mouth, it provokes good, nice, intense salivary secretion. That itself will help in keeping your mouth clean and flushes out a lot of bacteria. Enakku saliva echu oorudhu vandu kammiya aidutuna nariya dental decay varalam. Especially root decay. Root decay எதுனாலனா ஏஜ் ஆக ஈரு கீழே இறங்கலாம். அதனால பல்லு வேர்ல decay வந்துருதுன்னா அது டென்டிஸ்ட்க்கு அட்ரஸ் பண்ணுறது ரொம்ப கஷ்டமான வேலை. So one important thing that you need to take care of is your mouth should be well hydrated. Lot of over-the-counter medications are also available, like they are called as artificial saliva or carboxymethyl cellulose. அதை வந்து பெயிண்ட் மாதிரி நம்ம கோட் பண்ணிட்டோம்னா வாயில், it will be very easy. எனக்கு வாய் ட்ரையாக இருந்ததுன்னா denture wearing also becomes very complicated and very, very difficult. It can start irritating your mucosa or the lining which is there in your mouth. Second thing, tartar deposition. As we age and as saliva also changes, கால்சியமோட கான்சன்ட்ரேஷன் எச்எல்ல வந்து ஜாஸ்தி இருக்கிறதுனால நிறைய காரை டெபாசிட் ஆகும் வாயில். ஸோ அதை வந்து ரொட்டீன் ரெகுலர் டென்டல் விசிட்க்கு போனீங்கன்னா அதை க்ளீன் பண்ணிட்டீங்கன்னா யூ ஆட் அ லாட் ஆஃப் வேல்யூ டு யோர் டீத், யூ ஆட் அ லாட் ஆஃப் வேல்யூ டு யோர் gums as well as the underlying bone. Third important thing is, as I mentioned before, you might face a bit of difficulty in wearing your denture. எனக்கு வாயில் இருக்கிற சதை, அது மியூகோசான்னு சொல்லுவோம், அது வித் டைம் பிகாஸ் ஆஃப் ஹார்மோன் சேஞ்சஸ் ஆல்சோ இட் பிகம்ஸ் வெரி தின். அது தின் ஆகிறதுனால அந்த டென்ச்சர் வந்து as it slides over the mucosa, it can cause a lot of ulceration and irritation. So என்ன நீங்கள் பண்ணணும்னா, there are a lot of alternatives. Like for instance, if you can move on to implants, you probably can place an implant and you can replace your teeth. One thing you can do is that. Second thing, you can make sure that the denture is clean, because you don't want any bacteria. அதில் வந்து என்ன சாப்பாடு ஒன்றுமே இருக்கக்கூடாது, எஸ்பெஷலி அந்த உள் சர்ஃபேஸில். Give adequate amount of rest to your mouth. In the sense, night time denture wearing is what we never recommend. Remove your denture, put it in a container which has clean water, so that you get the tissues or your mucosa get adequate amount of rest. And keep your dentures clean. In the sense, you get a lot of these denture cleaning brushes or denture cleansing tablets which are available, which you can use once a week to make sure your denture is clean. Fourth change, எல்லாரும் கேள்விப்பட்டிருப்பீங்க about osteoporosis. Osteoporosis உங்கள் போன் வீக் ஆகுது. அதே மாதிரி ஜா போன்ஸ் எதில் வந்து உங்கள் பல்லு வந்து சப்போர்ட் பண்ணுறதோ அதுவும் வீக் ஆகலாம். Once your jaw bones basically become weak, there might be some kind of migrations. Migrationனா நிறைய பேர் வந்து சொல்லுவாங்க, பல்லு வந்து வரிசையில் இப்போ வந்து ஸ்பேசிங் வர ஆரம்பிக்கிறது, இடவடி வர்றது, முன்னாடி இல்லை அந்த ஸ்பேஸு, teeth மொபைலாக இருக்கலாம். Slightly the teeth will start basically moving. And third change that you might basically see because of bone changes is that denture வந்து லூஸ் ஆகலாம். So you will have to go back to the dentist and probably get a new denture refabricated. Another thing, you can take a lot of your calcium and vitamin D supplements. You can undergo when you go in for your master health checkup, or you can undergo some kind of a blood investigation, vitamin D levels paakalam, calcium levels paakalam, and you can supplement yourself in case these levels are low. Along with coordinating with your general physician, you can supplement this calcium level by taking exogenous source of calcium. I can, and of course, I would definitely want to emphasize, keep yourself physically fit, have a good nutritious diet, because that adds a lot of value to the teeth and to your gums and overall oral hygiene. We as women, I think we are primary caregivers. We may be like wives, we are mothers, we are sisters, we are daughters. We take so much care for our extended family. I think it's very important for us to emphasize on our health, so that you can be a primary caregiver for a long time to your family. That's when you can be physically, mentally and dentally fit. Thank you very much.